Hello, hello, hello. Welcome to Resilience. This is Sunday, May 15, 2020, and it is probably a little bit later than normal. It's a little bit after 7 for us. Just wanted to touch bases with you all today, and going to be on my own today. So today we're going to be basically talking about mental health awareness. Yes, that's right, people. It is the month of May for mental health awareness, as well as among other things. We brought it on, we've talked about it last year, is, behavioral issues, health issues, trying to help with stigmas that we so many have experienced, especially around this time of the pandemic. We've all have had some interesting testimonies and experiences and highlights that have occurred during the time of pandemic. We know that in your local areas, there are certain resources that you can contact to have assistance. They have it broadcasted all over the television, commercials, infomercials, and social media. But it's basically the hospitals and the health systems are playing a role providing behavioral health care, which is basically self-care. Within your communities. The hospitals created some partnerships that address behavioral or mental health issues. And many of us have suffered with these disorders because of not leaving the house, having to staying in the house, dealing with the gas prices, dealing with bills, jobs, friends, families, not being able to be in their presence and connect with them. But there's so many things. They do have some disorders are identified and can be treated. Not all can be treated. They do it through physical, behavioral services, emergency departments, inpatient, outpatient settings, and some partnerships. This is to help improve the value of our health and the health care. And to have quality of care, and sometimes the costs, and some of those costs are actually free resources. So you might want to check into it. We want to try to make a commitment to support the effort and betterment for ourselves. And there are also advocates out there also to help you with the related issues. There are such things as the AHA resources, which also is the new one recently was the Child and Adolescent Mental Health and Maternal Mental Health. They have web pages and practices and information and resources that are, designed to provide, that are also through hospitals and certain health systems and communities. And that's just basically, some others who have been pregnant and going through the pandemic have suffered from postpartum or, dealing with it alone. There's so many things. Also, you also want to look at certain things that you would like to write down and research to make sure. And sometimes some people may not even feel like it as though they want to. But there are so many things around the nation that offers insight to the communities, to improving, and that give you access, especially throughout your region, community, nation, and whatnot, what have you. It has been a known study, and it's still continuously growing. And, these things matter, because if you say that you love thy neighbor and you love yourself, you have to love yourself and correct yourself and get yourself, help prior to trying to help someone else. Now, you can point them in the direction, and that's fine, so be it as it may. But if we do this thing together and help one another and not push each other down, and I noticed that sometimes people use the social media platform for the demise and not for the improvement. If you see there's an area that needs to be improved, what's wrong with pointing that sister or brother into that direction? But the National Prevention Week was from May 8th, May 14th, and that's the annual observance dedicated to increasing public awareness and action around substance use, prevention, and promotion of positive mental health. So we just passed that and we had that. Then they have the Sound the Alarm for the Kids. That raises the awareness of the National Emergency for Child and Adolescent Mental Health, because we have a lot of children, whether we know it or not, whether they are closed off or choose to speak in regarding about the mental health awareness. And of course, we got NAMI, which is the National Alliance of Mental Health Illnesses Resources, which is basically about personal stories, testimonies, videos, blogs, social media engagements, and national events. It's been a situation that has grown, as I stated before, over the years, and we're glad that it's being prone and that's being pushed to the forefront and not pushed away and pushed off and not dealt with. We need to make sure that we are able to deal with these things. Now, on the 16th of May, they're going to have the National Older Adult Mental Health Awareness Day Symposium. Check your local areas for that as well. Understand that with the mental health, we're trying to recognize in the United States predominantly, it's all over. It's been observed every year since 1949. And we're trying to help eliminate the stigma, like I stated before, associated with mental illnesses. And the more studies we have, the more conditions, and then we can try to not cure, but manage and cope with it on a daily basis. What can you do? You can take time, like I said, to research and understand the importance of positive mental well-being, not just daily, not just for this month, but throughout the year. It's been known by studies that more than 51 million people have experienced mental health issues since 2019. They're basically stating, and this is according to Mental Health's Cornerstone or Centerstone.org, not of our own, so we don't own the rights to this, but this is just healthy information. 1 in every 5 adults or 1 in 6 youth experience mental health issues. It is also shown that 45% of adults and 51% of children with mental health issues have received treatment. A lot of them commonly known as anxiety disorders in the U.S., affecting more than 19% of adults population each year. But you can strike up a conversation or open dialogue with one another positively to get that person to feel comfortable to know that they can convey and confide in the situation. It takes work. And as the Bible says, faith without work and without faith is dead. So you got to do the work and you got to continue to stay aborted. Now, does that mean that you're not going to have any backslides or slip-ups or, whatnot? No, you're going to have those issues, but you need to just learn to utilize the resources that are spread about and talked about, and don't try to do it on your own. Find someone that you, like I said before, to confide in that can assist you along one. Have a buddy. And then, allow others to offer their true, genuine support as you do the same thing if you're the one that's going through struggling of mental health issues and vice versa. Also, once you get to the point where you're able to just, disclose it and talk about it, let that be a testimony. Let that show to other people that you're not alone, that you can fight the good fight. And again, this is based off of Mental Health Centerstone.org. And they also have like a location finder within that you can have in your city to find out certain things within your area, like resources or communities or whatnot, providing that information that you can find to help you. But it's just this thing that we don't want to promote shame or secrecy, and you definitely, please don't suffer in silence. Do not suffer in silence, sweethearts. Please make sure that you can start a diary, do a diary or a video blog. Keep it upon yourselves until you're ready to release it. But if you do this, don't allow it to extend periods daily. Try to get yourself involved in certain activities that you're comfortable within your proximity, like standing outside, having a cup of coffee, waking up in the morning, taking a 15-minute walk, listening to your favorite song, listening to some gospel, whatever is your preference that is positive and that helps you to maintain and to be stable as much as you possibly can. They do have situations, numbers that you can contact someone to talk to. Don't you yourself trying to understand it, because sometimes you yourself might find yourself falling back and not getting to the root of it. But a lot of the things that people suffer from, besides anxiety that plays within it and depression, just like panic attacks, disorders. Sometimes people have excessive sweating, digestive issues, heart palpitations and stomach aches, breathing, trembling, shaking, difficulty breathing, sometimes chest pains and whatnot. And some people deal with it by trying to medicate it, whether over the counter or not. And this is coming from niznikhealth.com as well. A lot of this information can be Googled or, as I stated before, researched within your local areas. Please try to start with you. In order for things to be correct, you have to learn to correct yourself. You have to learn to withstand correction. And in order to be better, you have to be picked and pruned. And that's daily. Take self-examination. And what I've learned from my sissy in love, shadow. Do some shadow work. Find out what your problems are. Write the pros and cons about what you and who you are. But mostly start with you. I hope that you all are chimed in. I'm praying that everybody is doing well out there. And I know that right now we're still within the pandemic, and as it's been quoted in the rumors that we are dealing with a depression area, which every few years or every however many centuries or however decades, we're dealing with some type of depression era. Right now, as you noticed, as I stated earlier, gas prices are going up. Food has gone up. But need not to worry. Try not to worry. Pray and ask God to keep you in his bosom. Pray and ask God to keep you in a place to not focus on all the things that are around you, but focus on him so that he keep you in a perfect will and place and in peace. Because if not, you will be consumed and you will find yourself falling in into, everything, paying attention, suffering, hurting yourself. We don't want you to do that. You can also, again, check us out. And you can also, if you want to be a viewer or a guest and you want to be a testimony to others to encourage because you've been there and done that and you want to tell your story, please check us out here at ResilienceWithBrittandDawn.com. You can Google us. We're on Buzzsprout. We're on StreamYard. We are also on IG, Spotify, YouTube, Twitter, Facebook, TikTok. Yes, we are on there, and Snapchat. You can check us out on all of those places. You can email us at resilience1203@yahoo.com, and just to give us a feed of your story. Please provide us your information and name, and we'll definitely reply back to you. And no, it's not automated. It is us replying back to you personally, because we believe on touching bases and believe in connecting with not just the audience, not with just us, but together we can connect and we can get through this. So I want you all to take time out, take a breather. Take a breather, inhale, exhale, and know that you got this. It's going to be okay. No matter how badly it looks, know that there's someone there going through it with you. And know that there is someone always there to talk with you. And know, if you're a believer, that God is right there with you. I am Miss Bridge, and on behalf of my friend Miss Stone, we love you, and we hope that you continuously to stay resilient and be the resilient that we know, and stay enduring through the fight of the good fight. And we hope that you all have a blessed day. And until then, toodles, stay resilient, and we love you.